Hi everyone, thank you for having us. So we're here from NHS Digital today to talk to you about designing a national booking service for COVID-19 vaccination appointments. So we want to talk to you about how when you're working on something that is high profile, quite uncertain, under lots of pressure, it is still possible to take a user-centered design approach. Might not be able to be a user-centered design purist, but there are certainly plenty of opportunities to still work in that way. And as I'm sure you can all imagine, that was a service that was all of those things. So we're here today to use that as a bit of a case study, I guess. So to introduce myself, my name's Emma. I'm a service design lead and I work at NHS Digital in the bit of the organisation called Citizen Health Tech, and we deliver the NHS website, the NHS app and NHS login. I'll let my colleagues introduce themselves too.
I'm Lucy Winder. I'm a senior user researcher. I work on the NHS app, but spent 4 months working with Emma on book coronavirus vaccination.
So I'm James Higgott. I'm a lead product manager. I spent about 8 months working on the book coronavirus vaccination service. I've been doing sort of product management across other bits of NHS Digital for several years now.
Excellent. So this is going to be a bit of a team effort today. I'm going to start, and to do that, we need to rewind back to around August last year. If you can cast your minds back then, I think we were maybe in a break between lockdowns, enjoying some glorious British sunshine at that point. But that was definitely the point where the vaccine was still a bit of a distant dream. That was when the kind of work started, the initial work started for us. But obviously things were still very uncertain. We didn't know which vaccine was going to land. We didn't know when. We didn't really know much about the kind of vaccine rollout as a whole and who would be prioritised within the population to go first and how that would work. So in these early stages, we were basically given a set of requirements, which is fairly common at NHS Digital in terms of how we get commissioned to build technology. But these requirements were for a booking engine and basically a piece of off-the-shelf software, which was probably going to do some of what we needed, but certainly not all, because we needed to ensure that we were building a whole service that would work for users from end to end. And as part of this service, once we got our heads around kind of what was involved, we actually ended up delivering 3 products. So that off-the-shelf booking engine was called Qflow, and that was one of the products that we procured and customized to some degree. But we also built 2 more products. We built the front end booking service, which is what hopefully some of you might have used by now, accessible via the NHS website, and that actually included a separate instance for use in the call centre as well. So if any of you or people you know have booked over the phone, that same technology is used by the call centre staff. And we also built a check-in app, which is used at some vaccination sites, not all, to check people in when they arrive. But we needed to design and develop these products in the context of an end-to-end journey. This is something that's quite usual for NHSD. We get commissioned to build bits of technology, but we rarely get commissioned to deliver a whole end-to-end service. And that's just by the nature of what we do. We're a technology provider. But we wanted to, keep user-centered design at the heart of this, and part of that is ensuring that we have the context of the whole end-to-end service and how booking fits into someone effectively getting their vaccine, because that's the end goal for somebody. So we started with a 2-week design sprint. That was really important to us to make sure we had a bit of time and space in the early stages to make sure that we really looked at what it was that we needed to design and deliver. And there were probably 3 parts to how we worked within that sprint. We did some service design, so we really, as I said, needed to map out that end-to-end journey of booking, both back and front end. And this was a very close collaboration between service design and technical architecture to ensure that the user experience someone was going to have worked alongside the kind of data flows that were needed in the back end. We needed to, like I said, understand booking within that wider context, and we wanted to build and test an early prototype. Lucy will talk more about this, but user research was an important part of the delivery throughout, and that started within this sprint. She'll also talk about some of the challenges, but in this early sprint, recruiting people for this research was challenging. We didn't know who was going to be receiving the vaccine. And that research kind of was twofold. So we did exploratory user research interviews to understand people's early attitudes to getting the vaccine. As you can imagine, this was really interesting as the year progressed, and the media was reporting on the development of the vaccine. Attitudes started to change in various directions, and we did test an early prototype for booking. But really importantly, we needed to scope a realistic delivery plan for build, and really understand what we were building and how we were going to do that, because this was midway through the pandemic's still going on, right? But midway through into COVID, and we'd already redeployed teams onto other COVID work, and so everyone was very busy, as you can imagine. So we needed to understand how we could feasibly deliver this with the resources we had, and where we needed to bring suppliers on board. And as I'm sure you could probably guess, we were pushed for a very tight delivery timeframe. Initially, a 6-week delivery plan was tabled. It did end up being slightly longer than that, mainly because the vaccine didn't land on Public Health England's doorstep when we thought it would. That was all going on around Christmas, so it was an interesting Christmas for us, not knowing whether we were going to be launching the service on Christmas Day. Could have happened at one point. And we ended up having 2 multidisciplinary internal teams, so one working on the kind of citizen-facing side of the products, and one working on the staff-facing team. And we did bring in a supplier team to deliver the Qflow product that we spoke about. We worked in 2-week sprint cycles with show and tells around every sprint, which was really important, especially in the early stages when the program was still fairly disparate and still forming, and a large program as well with different parts beyond the bit we were doing. We had overarching leadership across design, product and delivery. And as I said, it was really important that we did user research every sprint. But we did face challenges. I think, the 3 of us, and I think a lot of people at NHSD like to talk quite openly and honestly about the work that we do. It would be silly for us to stand here and say, yes, we were able to be like user-centered design perfectionists throughout. It just wasn't that type of project, but we were able to do what we could throughout, and I'm hopeful we can share some of those stories with you today. But some of the challenges we faced were around user research recruitment on both sides, users of the service, but also staff. They hadn't recruited staff to work in the vaccination sites at that point. They hadn't built the vaccination sites at that point. So we were operating with really high levels of uncertainty. Again, we didn't know what vaccine would land first, which did affect some of the kind of business rules we were building into the product, things like time between doses, for example. And as I said, a big challenge in terms of only delivering kind of part of an end-to-end service and understanding how we could deliver that part in the best way possible, considering the wider context. And as well, we were a digital booking channel, but we needed to be cognizant that, especially as the policy for rollout became apparent, a lot of those people in the early days are going to be booking over the phone. So it was important that we considered how those 2 channels worked together. So as I said, we'd like to share a couple of stories about pre-launch, like before we launched the service, and how we maintained the user-centered design approach. And then James is going to talk a little bit about how we did that after launch as well. So I'll hand over to Lucy for the first story.
Yeah, so I'm going to talk about some research that we did with vulnerable groups, that we could provide reassurance to this group of people through our product. If you could move to the next slide, please, Emma. So we had a requirement along the way that we were going to need to provide slots to people who, reduced capacity slots to people who had been defined as clinically extremely vulnerable. This list you can see right now is the gov.uk kind of definition of people who fall under the category of clinically extremely vulnerable. And this changed along the way. This list isn't the same list we were working to back before Christmas. But we needed to do research with this group to try and understand how did people find out they were clinically extremely vulnerable? What were their concerns? What were their worries about receiving the vaccination? What support would people need to be able to attend? And what we need to take into consideration to ensure that this group of people can book, manage and attend their appointments successfully. You can move to the next slide. I think it's safe to say that what we found, the overarching finding from our research with people who were vulnerable was that they were anxious. Really interesting sessions with people who told us a lot about how their mental health had suffered a lot during the pandemic. People had spent months inside. One person told us that they only went out to exercise, and that was in a concrete car park opposite their house. They went at funny times of the day to ensure that they were there on their own. And so they were particularly anxious. This then led into them being anxious about booking and attending their appointments. This potentially, at the time, we believed that mass vaccination sites would be for everybody. They were going to be huge venues with potentially hundreds of people, maybe, like football stadiums. So talking about this possibility with people actually filled people with dread. As you can see some of the quotes, it was really scary at that time for lots of people. We spoke to people who had organ transplants, who'd had organs removed, someone with a learning difficulty, and this all led to kind of real anxiety. So we really needed to ensure that our content and design could provide reassurance that people could safely attend their appointments. You could move to the next slide. So yeah, this kind of led to this hypothesis. So what we got from our research was that people were really keen to receive the vaccine. They saw it as a safety mechanism. They saw it the key to kind of moving on and getting on with life, but they were still really worried about going and attending their appointment. So the person I spoke to who had learning difficulties also only had one kidney, and he was really worried about potentially losing his other kidney by, the vaccine, maybe worried about receiving the vaccine, but also kind of going and mixing with people who may well have COVID. So how might we provide reassurance to these people to enable them to book and manage their appointment? So what did we do? We learned more about our users. If you can move to the next slide, Emma, what did they tell us? So we knew that I've kind of mentioned a lot of this already, but we knew that the thought of going to a large vaccination site was worrying. We knew that many of these people may require support on the day for a friend or relation. They also wanted to know, can I bring someone with me to support me answering questions about my medical history that I might not know, or actually to provide me with support because I'm not that mobile and I'm going to struggle to maybe get upstairs or get into a room to have the vaccination. Also, kind of, how long will it take? How much time will I need to take out of work? If I need a carer to come with me, I need to be able to tell them how long I'll need them for. Lots of people, so we spoke to carers of people who have terminal illnesses. They wanted to know, well, can I book the appointment on behalf of the person that I care for, and vice versa. We learned a lot about how people had been notified about shielding, and we learned that notifications and messaging around that time had been really confusing. Some people told us they'd received up to 6 letters and notifications that they needed to shield from different organisations, some contradicting others. So we knew that we needed real clear messages about what needed to be done to book your appointment. So if we go to the next slide, this is something that we did to try and meet that requirement of providing reassurance. We gathered questions and concerns from people. We were able to develop user needs and map the content to ensure that the content that we developed met those user needs. And we were able to provide reassurance at the right time. So this is the start page of the service. So the screenshot you can see on the left, and the smaller screenshot, that's what we started with. And at the end, when we went live with the MVP just before Christmas, this is then what we ended up with, trying to reassure people about what would happen on the day, what they would need to do. If you can move to the next slide. And then finally from me, the research we did with this group also contributed to our kind of understanding of what kind of access needs people might have to get into a venue and what they might need whilst they're there. So we talked to people about what kind of additional requirements might they need, and we iterated this list based on what people told us, but also what we knew would be available once the vaccination sites had been booked or built. So we really started to try and understand what access needs were required from our users. And that's it from me, and I'm going to pass back to Emma.
Thanks, Lucy. So the second story we want to tell about the kind of work we did pre-launch It's about making sure that we were designing a service that was going to be inclusive for people of any sex or gender. And when we talk about this story, we always reiterate the point that sex and gender are not the same thing. And that is one of the, I guess, misunderstandings that lies at the heart of the problem that we faced. The other thing to keep in mind when talking about this story is that all people are not treated equally, sadly, and the trans community especially face significant levels of discrimination. I'm not going to go through all these sad statistics that are on the screen, but we wanted to make sure, as the National Health Service, most importantly, but anybody should be making sure that anybody can use your service and that there isn't a barrier in the way for them to do that. We knew this was going to be a national service that everybody in the country over the age of 18 would need to use. So this was top of mind for us. So the problem we faced here was that we needed to match people to an existing service called the personal demographic service. That was how we were going to give people access to the service, and that was about checking who you were, so doing a kind of an identity verification in inverted commas, because it's not formally that, but we needed it to be fairly low barrier to entry because of the high usage it was going to get. So there were two ways that we could do this check. You could either enter your NHS number, or you could enter a series of demographic details. Now, we know that a lot of people don't know their NHS numbers, so we knew that an alternative route needed to be there. What we didn't know at the time, and this was about kind of 2 to 3 weeks before launch, was that a gender was included as a mandatory field in the API that does that matching to that service. There were deeper problems with this. The data is labelled gender and the attributes held talk to sex, male or female, and obviously the other two options you have are not that useful, unspecified or unknown. And then another problem is that essentially this is about matching to an internal technology system that we have and we have developed and built as NHS Digital. So that's very difficult to explain in some hint text. We're not collecting this data for clinical purposes. We're not collecting it for a monitoring reason, and that is collected elsewhere. But this was simply to identify somebody. So that's difficult to explain. So all of those things combined make it very challenging to design a fully inclusive front-end service. So we worked very closely with technical architecture again to look at, is there a technical solution we could implement that means that we don't have to ask this question? We explored doing multiple API calls behind the scenes for each user. Other services have done this in the past, and we looked at cascading API calls, which is where you stop when you find somebody. But both of these solutions were deemed not possible, mainly because this was a very high profile service. There was a lot of concern about performance, and this was deemed to be too much of a risk. So we had to accept that we were going to have to add the question, and we worked very closely with lots of disciplines to create what we thought would be the most inclusive way to ask this question, given the constraints that we were facing. We had a lot of existing knowledge in our content community. We worked with the LGBT health team in NHS England. This wasn't, this had been faced before. We didn't need to kind of reinvent the wheel as such. Hopefully you can read the screen, but the small text says we're asking for this information to match your vaccination record to your GP record. So just being really clear about why we're asking. And the 5 options we offer are female, male, non-binary, prefer not to say, and how I self-describe may not match my GP record. The last one being very important for trans people who are going through transition, who know that what is on their GP record, because that can sometimes be difficult to change, doesn't match how they self-identify. And it's important to explain how this works. So if you select male or female, that just does the one API call. And, there was a working assumption that a large proportion of people would select one of those options. So we were allowed to implement the four API calls for the other options, because that would be a small percentage and it wouldn't generate the performance risk that would have done if we'd done 4 API calls on everything. And we tested this with user research. We tested with trans people, with non-binary people, and it tested really well. Thankfully, people were reassured by it and felt like they were being heard, and this wouldn't present a barrier to them accessing their vaccination. which we also heard post-launch as well, which was great. We had people getting in touch to say that they had booked a vaccine because of this, which is really great and kind of makes all this work worthwhile. But ultimately, there was a bigger case for change needed here. We weren't happy about having to add the question in at all, to be honest. We didn't think this was information that needed to be entered when you were booking a vaccination appointment. We were simply constrained by our own technical systems. So we did a lot of work to make the case for change. We were lucky that this was a very high profile service. We used that as a springboard to build momentum and awareness right to the top of the organisation around the importance of this. And ultimately, there were two pieces of work that needed to be done. Obviously, those pieces of work were led by different teams. So this was a case of getting prioritisation on two different backlogs. We needed to make the case with the team that worked on the personal demographics service, that they would do the development work to remove gender from the matching API. And we also needed to work with the vaccine booking team to make the case to do the development work to remove it, which actually is quite a bit of dev work just to take something out. Those two things did happen in the end. PDS did their work first, closely followed by the vaccine booking team. And I can't remember exactly, but I think about 8 weeks after launch, we were able to remove the question, which was really great. But it's really important that we continued to champion for change in this space, because the problem lies at the data level. That's what's making designing inclusive front ends difficult. And we continue to work on this in NHS Digital. So at this point, I'll hand over to James, who will talk a little bit about how we've continued to use a user-centered design approach post-launch on the live service.
Thanks, Emma. If we can move to the next slide, please. I think it's helpful just to have a quick sort of timeline of what happened. So we launched the back end part, the booking engine part of the service to the people who are managing the first vaccination sites on the 15th of December. We then went live to the public on, I believe, the 9th of January. At that point, there were just 8 vaccination sites offering appointments, just tiny handful across the country. But over the following sort of 5 months, the number of sites and therefore the number of appointments has been increasing every week. There's now more than 800 sites on the system, and as of a few days ago, more than 27 million appointments have been booked so far. All the time over these sort of 5 months since launch, there have been so many changes to the operations of the whole sort of vaccine program, to clinical policy, to sort of business rules. All sorts of changes like this, new cohorts becoming eligible, sites opening, sites closing, changes to the interval between doses, as well as the usual sort of bugs and firefighting you get on a service like this. So a large part of our backlog was dealing with stuff that sort of came up like this, often with little or no warning, that were essentially dictated to us either by the program, by clinical policy. It didn't necessarily sort of come from our own user research, and didn't necessarily have a sort of specific user need behind them, but that didn't stop us from sort of approaching these problems in a user-centered way. When we look at the next slide, we'll see an example of one change that we had to make. This was a clinical policy change. It was decided that pregnant people would not be offered the AstraZeneca vaccine, that they should have the Pfizer or the Moderna vaccines. That meant that if we wanted to allow pregnant people to book on the site, we would need to find out if they were pregnant, and then to remove AstraZeneca from the list of vaccination appointments that they might be offered. Initially, when this policy was decided, the only thing we could do was to put a warning on the front page which said, if you're pregnant, please don't book using this service. But obviously that was not good enough. We had to sort of get we ended up with this question into the service as quickly as possible so that pregnant people could book appointments. there wasn't time to sort of recruit people and do usability testing in order to get this out in the first instance, but we were able to lean on a great deal of existing user research findings and sort of knowledge and experience from other teams at NHS Digital, and speaking to the user researchers, the designers on the National Booking Service team, they felt that they were confident to release this without sort of any specific usability testing. But we did usability testing sort of immediately afterwards, and we iterated it to the version that you're seeing on screen now. And the testing, found that it was a usable sort of question, and that people were pretty happy with it. But it also uncovered other insights, telling us that users wanted reassurance that they'd be given the correct vaccine, whatever the sort of vaccine that would be. If you probably aware that sort of people under 40 and pregnant people are not offered the AstraZeneca vaccine as standard. If we look at the next slide, we'll also sort of cover off some of the iterative user-led improvements that were also going on at the same time. So these are all examples of sort of stuff that we're doing, as well as the sort of the urgent responsive changes that I've talked about. There's a mix on here, stuff that was for the public-facing part of the service, but also for the back office systems. If you remember that, site managers and people working at vaccination sites were our users too. So we had multiple sources of information which sort of alerted us to these problems. We used surveys, we used Hotjar recordings, we had labs for generative research and usability testing. We looked at sort of queries coming into our service desk. Social media was a great source of information, analytics and feedback from sort of vaccination sites themselves. And I'll give you one example on the next page of where a sort of a usability problem created actual sort of real world issues. So on the left side of the screen there, you'll see the original version of our confirm your appointment screen. Now, this is a pretty standard pattern that's used on a lot of Gov and NHS digital services. We essentially, before someone actually commits to booking something or selecting something, we play back the things that they have chosen so far, so that they have got the option to sort of go back and change some of that before they actually before they book it. But what we were finding is that an awful lot of people were getting to this screen and they were thinking that they had completed the journey, and they would screenshot this page or they would print the screen out, and they wouldn't click the big green button at the bottom saying save and continue. And what this meant was there was a lot of people who were then turning up at the appointments they thought they had booked at the vaccination sites, but they hadn't actually confirmed those appointments. So this was causing all sorts of issues at the sites themselves, because they would have more people turning up on a single day than they actually had vaccine supply for, and also causing problems for the individuals themselves, because they would go along to a site and, well, depending on the vaccine supply at that particular site, they may or may not be able to actually get their jab. So definitely a sort of real usability problem, and something that we, with a bit of research, bit of sort of extra design, we were able to change. We were able to make the headline, the title on the page, much more explicit, that you need to check your appointments and confirm them before booking. New content on the page sort of reiterated this message, and a change to the submit button made it clearer that you needed to accept and book. So that had a sort of real impact on that particular problem. So I think, what are the lessons to be learned? We've given a few examples of the sort of things that we were looking at. I think for me, one of the big lessons to be learned is that you're not going to be able to solve every single problem, and this is true whatever you're working on, whether it's a small sort of niche service, or whether it's a large high profile service like this. You can't fix everything. A certain degree of pragmatism is vital, and you have to prioritize the problems that you think need solving the most, and the ones that you have the capacity to solve. I appreciate I'm probably speaking to preaching to the choir here, but if there are other product managers here, I would say speak to your user researchers and your designers and get a feel from them about which are the biggest problems, the most solvable problems, and focus on those ones first. But acknowledge as well that you won't always make the right decisions. In the last example here, I will highlight a cancel and rebook appointment service part of the service, which we'd actually did some exploratory user research and usability testing on, I think back in sort of March or April, and we'd identified this as a problem. People who were using the sort of manage my appointments did not like the idea of having to cancel their existing appointment before booking a new one. They were really concerned that there might not be a new one to book, or that their new one might actually be later than their original one, or that it might be at a site that was less convenient for them. So we definitely recognised this was a problem, and we chose to deprioritise it because it was a smallish number of people who were actually cancelling and rebooking. It was a less used part of the service, and frankly, at the time, we just had sort of bigger and more urgent things to focus on. But that sort of decision blew up in our faces a little bit about 4 to 5 weeks ago, when the government announced that they wanted to shorten the interval between doses from 11 to 12 weeks down to 8 weeks. So all these people who'd booked 2 appointments with a gap of 11 to 12 weeks between them were now coming in to cancel their second dose appointment and to book for an earlier second dose appointment, and it required them to use this part of the service. And we saw in so much over social, so much in sort of anecdotal feedback in our surveys about the people's reluctance to do that. And so we very quickly, and I'm really pleased to say that actually this new bit of the service went out last night. People who are cancelling their appointment can now sort of check the availability at their chosen site before they cancel it, rather than having to just sort of be really brave and cancel and hope that you will get an appointment. So yeah, I really hope that we've sort of conveyed the idea that that even when you're working on something so fast-paced, high-profile, it's still possible to stick to your user-centered design, human-centered design, agile, UX, guns, and continue to be user-centered in your work. And as Emma said at the beginning, you might not be able to be a purist about things. You're going to have to be creative and pragmatic about how you solve problems, and you won't get everything right. But it is possible to at least practice UCD. I think it also helped that the National Booking Service team that came together, it was pulled together really quickly from sort of multiple bits of NHS Digital and beyond. Worked really well together. There was a really strong and obvious common purpose, which I think sort of bound us together. But it was also just a really positive environment in which to do user-centered design work. There was a shared belief across the whole team that practicing user-centered design was, would help us to build a better product, even when we had such challenging timescales. And finally, on a personal note, I'd say that this project is the single most intense thing I've ever worked on. But if you ever get the chance to do something similarly high profile and of such value to society, I really strongly recommend it. We have somehow finished bang on 30 minutes. That's never happened before. So we genuinely have 10 minutes for questions before the break.
Well, that's fantastic. Thank you so much, Lucy, Emma, James. Really appreciate it. I'm not in the country, so from what I can gather, you guys did a sterling job. So well done. The question was from my side, and I see Jason Hodge answered that already. Is just does the citizens or whoever's booking it get to decide which vaccine they take?
Shall I answer that one? So No, they don't. When the service launched, there was only AstraZeneca vaccine in the country. Or rather, there was only AstraZeneca vaccine on the national booking service. So everyone booking just got that. As other vaccines were added, we would, majority of people were actually able to have any of them. So they would just essentially randomly get assigned one of those vaccines. And then as new clinical rules came into play about the under 30s shouldn't get AstraZeneca, and then it was the under 40s, and then it was pregnant people, they would sort of be excluded. But let's say someone who is under 30 who went onto the booking system today to book their first and second dose appointments, they would get either Pfizer or Moderna. They wouldn't know which one they were booking, and they wouldn't know until they actually turned up on the site and it got put into their arm which one they'd received.
That's great. Okay. So I'm going to open it up for a couple of minutes. I think we've got about 8 minutes left. We've got a question. Do the vaccinations teams use the native Qflow product for checking patients in, etc. directly, or do they use your product UI?
So I can probably answer that one again. So yeah, Qflow does have a native sort of check-in product. We sort of quite early on, we established that that wasn't actually going to work for the particular use cases that we had. So we needed something that was probably a little bit simpler, something that was sort of better suited to mobile devices that the check-in staff working on site would be using. So we quickly sort of designed and built our own check-in app, which sort of communicated to the Qflow booking engine via API. So no, that was a sort of a custom bit of software that we decided to use. And as Emma said, not every site decided to use that in the first instance, but the last time I looked, it was the vast majority of sites were probably sort of 90% of sites were using the check-in app that we designed and built.
Okay, great stuff. How big was the team? If you guys were working?
I can take that so that James can have a break. It changed over time, and the reason why we wanted to all do this together was because of that, because Lucy and I left the team at Christmas, so we kind of worked on the project up until launch, and then the team has moved around like through various kind of stages of delivery. But that initial team, God, I'm kind of pulling figures out of the air, but like I said, there were two kind of delivery teams internally at NHSD, like a staff-facing team that James led, which was maybe like quite small, James, like 8-10 people, and we got some extra jobs from the supplier. And then the citizen-facing team was probably a little bit bigger on the other side. But then that changed as the kind of service went live, and we did have a supplier delivering the Qflow product as well. So and we were part of a wider program, so that we were part of like the tech and data work stream of a much bigger program that was looking at kind of all the data flows and wider parts of the service as well. So there were a lot of people beyond just our team as well.
Excellent. And just I missed the first part of your presentation when it came to just the information or the data that need to be collected from the public to book their appointment. So they would just need name and surname, NI number, or?
Yeah, so I guess I touched on that when I talked about the kind of inclusive gender work that we did.
Yeah.
But what you need to enter, there are two pathways in basically, and the way it works is we check someone's identity against the personal demographic service, which is kind of like the national database of NHS numbers. So if you've got your NHS number, you can just enter, I think it's that and date of birth. don't quote me on this. James is nodding. My memory back to last year. But if we know a lot of people don't know their NHS numbers, so you can also go in by entering your demographic details, which is first name, surname, postcode. It has to be the postcode of the address that your GP has registered. Same with names, date of birth, and obviously we had the gender thing, which we then removed. Okay.
The only reason why I ask, because I can see, massive problems when it comes to Gareth Jones, and if you don't have his postcode, that's going to be a problem there.
Yeah, I mean, it's a problem faced by any service that is tapping into the personal demographic service. So we're aware that, there are problems when people have changed their name, for example, if they've got married, moved house, not changed their details with their GP, etc. So we do all we can to, through content and prompts, help people enter the right data and give them, if they do fail, give them guidance on kind of what to do next. I actually found out through having my vaccine that my GP had my postcode recorded wrong, because I'd been using the service obviously again and again to test it, and it was a real mystery as to why I couldn't get in. And when I actually had my vaccine, they were like, they got one letter of my postcode wrong.
That's interesting.
It's worth adding as well that the call center that Emma mentioned up at the start was really helpful in sort of solving some of those problems. So the call center was there for people who wanted to speak to someone and book by speaking to someone rather than using a digital service online. But the call center also had access to slightly more advanced lookup tools so that they could help with any of those issues arising.
Okay, fantastic. So yeah, thank you so much. I think let's just leave it for another 2 minutes if there's any other questions, but I can't thank you guys enough. I know you've been doing a sterling job. We've been watching all over the world, just, the roll-up when it comes to the NHS. I think it's all eyes. I don't know if you understand the magnitude of what you guys have achieved, but I think the rest of the world has really been watching. So I think Victorine just made a mention there in the chat. Thank you for explaining the planning and strategizing, which is it's super important. So guys, thank you so much.
There's actually one more question come up from Phil. It says, what's the split between digital and call center bookings roughly? And that split was about 10 to 12% on call center, sort of at the beginning when we were dealing with mainly sort of older cohorts, but it is decreased over time. And I can't remember what it's at right now, but it's down by several percentage points now.
Thank you very much, and enjoy the rest of your afternoon and day.
Thank you all. Bye.
Thanks for having us.
Thank you.
Bye.
Fantastic.